Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and I am here today on a Saturday for a Saturday session of podcasting with my most amazing co-host, Dr. Millicent Rovelo. How are you?
I'm good. You could call me like a Saturday special.
That's true. It's like, we got to do this. We're getting ready to head out of town, and we just need to get through some really crucial information, which I think is going to help us in our endeavors in Paris at the MCAS.
Right. We are gearing up to go to Paris next week. And our week this week was just super busy, so we're cramming this in on the weekend because we want to make sure that we stay on top of our podcast because we have a very important one that we've been asked to do today.
Yes, I was requested by my amazing executive assistant to provide a update on Facelift 101, basically.
Right. 101.2.
Yeah, let's do it that way. So when people are thinking about a facelift, there are lots of questions that come up, like, what does that even mean? What's that operation? And so the strictest of definitions, people typically think of a facelift as the lower face and neck. But most of the time, what they're really saying is, I want a facelift, which includes everything: brow, eyes, lips, whatever, fat grafting. And that's traditionally how I kind of think about it in that way, because I think when you're going in for facial rejuvenation, you want it all to be harmonious. You want to get it all done at one time, and the operations work better together when you're doing them simultaneously.
Yeah, absolutely. And the concept of a facelift is a very broad and diverse category. And certainly if you go back through our library of podcasts, you'll see that we delve into all of the specifics of different kinds of facelifts, various components of facelifts. So I don't want to get too specific today. I want to keep it pretty broad about what is a facelift and how is it done. But just bear in mind that there are many variations of facelifts, and there are very many different components to a facelift. And so this is just a sort of a broad understanding of what you can expect when you come in for a facelift consult and what the terms are that we use.
So let's start off with, I want to summarize our When Do You Get Your Facelift podcast in one sentence. Basically, if you're asking the question, it's probably time.
It's probably time. There is no right age for a facelift. If you see a problem that can be fixed by a facelift, then you are ready for a facelift if that's what you want. Obviously, you have to want it. So it can be when you're 40, it can be when you're 60, it can be when you're 35, it can be when you're 75. I would argue that if you're 75, you might be a little late to your facelift, but you will still see some great benefits, because this is the thing about a facelift. Once you've had your facelift, whatever age it is, your face will not age the same way a face would naturally age. And so if you have it when you're in your 40s, you can now enjoy the rest of your 40s with your new face and not constantly look in the mirror and be like, ugh, I'm getting old. So that's the benefit to doing it younger. The other benefit to doing it younger is that your skin is still really good quality. It'll hold the facelift results nicely. You'll look nice and fresh. You won't look like you've had a lot done to you. It just look like you're just that lucky, genetically freak person that just has aged well. If you do it when you're older, your skin's not as good a quality, it doesn't hold as well, and people will know that you kind of probably had something done because you didn't look great before and now you do.
It's true, and that's kind of the thing that I tell people. If you're asking the question and you're seeing jowls, you're seeing descent of the cheek, if your face has gone from heart-shaped to boxy, if the hollows under the eyes are looking puffy, if you got skin over the eyelids, if your brow has come down, all those things present on my face right this very minute, so that you can see that's when it's time to do your facelift.
You're ready for it.
That's right.
And so then that's when you come in and you start asking these questions. And those are the things you want to point out to your doctor. Some patients come in and they really can't be that specific about all the things you mentioned. They'll just come in and say, I look old, or I don't like how I'm looking, or I look tired. Some people will come in and they've done all their research and they'll point to everything on their face that they don't like. And either option is fine. But typically what I do, and what I'm sure you do as well, is once I have that patient coming in for some kind of facial rejuvenation, I hand them a mirror and I say, let me show you what I see from the top down. And I do that whole checklist. I start with the brows. Are they in proper position? The skin of the upper eyelids, is there extra skin? Then we go to the lower eyelids. Are there bags? Is there fat herniation? rejuvenation. Are there hollows under the eyes? Then we go to the cheeks. Have the cheeks descended? Then the lower face. Are there jowls? Is the jawline not as clean as it used to be? And then finally the neck. Are there bands in the neck? Is there loose skin of the neck? All of that is what's considered facial rejuvenation. And all of it can be broken into individual components. But when you're looking at it as a whole, that's what a facelift is.
Yeah, and I think that's the way to do it. And then at the consultation, what you're going to do is, kind of make all those assessments, decide what areas are you going to operate on. I don't want to forget the perioral region and the upper lip, because I tend to do upper lip lifts with my facelifts, and I tend to fat graft the area, the upper lip, the lips themselves. I tend to fat graft through the cheeks. So fat grafting is a big part of my facelifting. But after you've decided what it is you're going to do, then you can say, okay, so this is what the operation is. It's a brow lift, a mid-facelift, forelid blepharoplasty, the eyelid surgery. We're going to fat graft. We're going to lift the cheek. We're going to fat graft the nasolabial folds, upper lip lift, blah, 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 deep plane facelift, which we have a whole podcast about, whether to do a deep plane or a SMAS plication or a SMAS flap or a SMAS excision. All those things, take-home message, you're going to get the technique that works best for you. Granted, most of the time for my patients, it's a deep plane facelift unless they've already had a facelift, then it may be a plication or excision. But all those things will then add up to here's your operation. And you'll get the price quote. You'll freak. You won't realize, I didn't realize I was buying, another Mercedes-Benz, but it's kind of what it is.
I mean, it's your face.
It's your face. It's expensive. These operations cost a lot. I don't even need to talk to anybody about what inflation's done to the cost of medical care. I'm sure everybody knows. So it has gotten expensive. In Beverly Hills, I think the average ticket price for a facelift is somewhere between $65,000 and $150,000, depending on the experience of the surgeon, who you're going to, et cetera. Some are more, some are less. But if you're doing all those operations, you're going to be there for 6 hours or
easily.
For me, it's 5 to 6 hours. 12 is a long operation.
12 is a long operation.
I won't be there in 12
But it's
hours.
not uncommon for surgeons to do 12 hours when you're doing a full face. And that doesn't mean that anything is different or strange or weird. Some people just take longer. Some people go faster.
Yep.
And every surgeon has a comfort level with how fast they like to go in a surgery.
Yeah, and the length of time that you're in the operating room, if you're healthy and you've been worked up and you've gotten a clearance, from your medical doctor, cardiologist, et cetera, then the safety factor is very high. And
6-10 hours, it doesn't really make a difference if you're otherwise healthy.
Yeah, and if there are issues with your health, then maybe you do split it into 2 operations, which is totally fine too. And that's kind of what I do with a lot of my TV people, people who are on TV frequently, like newscasters, actors, et cetera. They tend to break these operations up and do them piecemeal so that nobody notices the big change if they're at that age that it will be sort of extreme to do it all in one shot.
Yeah, that's an option too. You can sort of ease your way into it so people don't know that it's happened all at once. And the other thing I want to point out real quick about all the different terminology and procedures, because we get this all the time. Well, I just want a mini facelift. Get that? I just want a mini. People love a mini. And I think part of it is because nobody wants to admit that they need a full facelift. And there's a lot of social media verbiage and garbage about what a mini is. But when I think about a mini, I think of just a lower facelift. A lower facelift means that you're just addressing the lower third of the face.
The jowls.
The jowls. So you're not doing the brow, the eyelids, the cheek. And so for me, it's still an incision that goes around the ear, behind the ear, but it addresses the neck and the lower portion of the face. I call it a lower facelift, but other people will call it a mini. It's not a lunchtime facelift. You're not coming in and getting a little Botox filler, a touch of a laser. That's not a facelift. A mini facelift is still very much a surgical procedure. You can call it whatever you want, but you're getting a lower facelift.
Yeah, and that's also for men. Men never want to have a facelift. They want to have a neck lift with an upper facial extension. That's sort of how we couch it for the guys, because they don't want to have a facelift.
Well, they don't
They're
need a
fine
facelift.
getting their neck done.
But they don't need it. They just need their neck.
That's right. They just want their neck.
I hear that all the time.
So
Fine.
anyway,
Okay.
back to the operation. So then you're going to prepare for your operation. You're going to have your your symphony of procedures that you've put together that are going to be done.
Symphony.
It is. It is symphonic.
It's harmonious.
Exactly.
Blends.
And so you're going to get a clearance from your doctor. You're going to get, probably blood drawn, labs, EKG, whatever you need. And then you're going to, read all the consent forms, which, have scary things in them, like what are the complications? And we always talk about complications, bleeding, infection, hematomas, things like that. Truth be told, the common things that happen in facelift that are unfavorable but are not the end of the world are hematoma after surgery.
So, which is just a collection of blood that accumulates under the skin.
Yeah, because we're picking up the skin and picking up this mass, the thick coating over the muscles, and making pockets that are spaces that blood can bleed into, and those need to be drained right away. And then, it can be a little more bruising or whatever, but in the end, all evens out at the 5-month mark, which is when I take the pictures anyway. So hematoma is common, and then nerve weaknesses are really common. Temporal branch of the brow, the buccal branch is actually the most common.
Temporal branch is the brow, is the nerve that elevates your eyebrow. So you may.
So, Dr. Rovelo, here to translate. Thank you for that.
So you may have a weakness of one eyebrow. Usually it's just one, so you get kind of like a little Dr. Spock look. Or you can have a weakness of the muscles of the nerves that innervate the lower lip. So you may have one side of the lower lip that droops. And a lot of these things can be mitigated with Botoxing the other side. So you make the other side equally weak so that you don't look asymmetric. In general, these come back. The nerves, very incredibly rare, are permanently cut. Usually they're
not cut. They're just
traumatized, they're swollen, they're weak. Give it weeks to a month and a half, and they come back.
Yeah, I had one that lasted 6 months. It was very annoying. So I had to Botox, the other brow. And that's the thing, is we can mitigate the issues. The only downside of those brow weaknesses that really I know annoys my patients, because it annoys me, is that they don't see the effect of the brow lift. Because if there's no tone to the frontalis muscle, the muscle that lifts the brow, then it's not the brow lift that you did, which we do endoscopically. Both Dr. Rovelo and I prefer to do the upper face through small incisions on the temporal crest. So these basically 1 inch, maybe 1.5 inch incisions up in the brow that in the hair, to allow the endoscope and have us elevate everything off of the bones and do the lifting without having to cut on the face. Because the way that a lot of people are doing the upper face now is they're making hairline, what are called pretrichal, in front of the follicle or through the follicles to make the incisions, which is very easy to do because you're cutting right here, so taking some skin out is simple. The downside to that is I don't think you can really wear your hair up anymore unless you want those scars to be that obvious, and it just I don't like it. It's not for me.
But back to the nerve weakness.
Okay. Anyway, I just don't like that. I like hiding the incisions.
You were talking about the nerves and the eyebrows and the lift.
But then I just started thinking about this.
and then you got sideways.
Okay. Anyway, you can listen to the Preservation Facelift podcast, which is very important. So where you put the incisions is key. We do the upper face endoscopically. We do the lower face.
We're talking about the nerves.
Oh, I thought we were done with the nerves.
No.
What else do you want to talk about? The marginal
You
mandibular
were talking about
nerve?
how it annoyed your patients when they can't move their eyebrows and they can't see the effect of the lift. Because
it did. It annoys me too.
And it annoys you.
Yeah.
So that's the thing. And I tell people, if you're going to have a facelift, don't plan on having any headshots or major life events within a few months of your facelift in case you have one of these nerve weaknesses, because you don't want that to be a thing that is
you can still get them through it, though. You can, but it's not the best time to get your photos.
Ideally.
Take the photos at 5 months.
Yeah, you'd plan that better.
5 months, all this stuff takes care of itself.
Fine.
Yeah. Once, people, this ear looks different than this one. Of course they look different because they were different before surgery, but they're going to be different operated now. And so people look at everything and they're very critical after surgery. We totally get that. And we just said, yes, it's going to settle.
Let it be. We'll come back and it'll be fine.
Absolutely. And if anything is really like visually off, it's a local anesthetic and trimming a little skin, which, is pretty dang rare, but it does happen. I'm not saying it doesn't.
Yeah. Those are the complications that you could potentially have. And then once you've sort of looked at your consents and you've signed them and you've agreed to undergo the surgery and have all the consents, then it's your day of surgery. And then you do your surgery. And we can talk
Just hold still. That's all we want
briefly
you to
about what you can expect. You went through the endoscopic portion of the upper face. So this is going to be the part that addresses the brow as well as the mid face. So you're lifting the brow, you're lifting the mid face and putting it back sort of where it belongs. This is where the eyes are addressed as well, the upper eyelids, the lower eyelids. And then the actual facelift itself, those incisions that we talked about, which go right in front of the ear, or kind of in the cartilage of the ear, underneath the earlobe, and around behind the back of the ear. And that's what's going to get the skin of the lower face. So it's a combination approach between the brow and the lower face.
So the incisions, as you described, are somewhat in front of the ear, but I think the key, which we've done a whole podcast about this, is we hide them in the creases and then behind the tragus here.
Which is that little middle part of cartilage.
Yeah. So it's not in front.
In front, yeah.
I am going to tell you this, and I know that you're going to be shocked. I mean, people are still doing this incision. They are. And it's, no. The whole key to having this natural lift, this no-filter facelift, you can call them whatever you want. We have a whole podcast about me ranting about naming your facelift procedures. But I named mine anyway, so the natural lift is sort of my name.
Yes, doctor.
But I think I like no-filter facelift too, which we're doing with one of my patients, where she's in the healing part. And we've already done the lift. It's very cool. But those incisions are so obvious, I can't stand them. That's why we have to do them behind the tragus and then up high, up here. I don't go down the back of the neck. There are plenty of our colleagues that cut right down the hairline in the back of the neck. Again, I don't know how you wear your hair up. I mean, you can. It's just, hey, here's my facelift scar, which I don't think people really care. I really don't. But I just think it can be done in a way that it's hidden, that you don't have to call attention to it.
Right.
And, again, I every award season, one of my patients who is, constantly at these award shows, when she's on the red carpet, her hair is pulled all the way up, and she's had the full kit and caboodle. She's had everything. She's had the whole facial rejuvenation, and you cannot see those incisions anywhere. And she obviously has the confidence to wear hair because she has it pulled up like I Dream of Jeannie, basically, the old school kind of ponytail off the top of the head. And it looks, to me, I'm just like, could you just, in addition to saying who made your dress, say, oh, and Facelift by J. Calvert. That's all.
Yeah, that's the idea.
No, they don't say that.
No, they don't care. What facelift? I didn't have a facelift. I woke up like
I just look this great at, 59 years old.
But that's the idea, is that you do hide the scars in a way that people can go about their life and not have to worry about the average person seeing their scars. And so the surgery will be done in the technique that you and your surgeon have discussed and talked about and made a plan for. It'll take however long it takes. And then my preference is for my patients to go to an aftercare facility. I don't know if this is a nationwide thing, but certainly here in Los Angeles and the Beverly Hills area, we have a plethora of aftercare facilities to send our patients to. It's in a fancy hotel or in a special house up in the hills with private nurses, and they take care of them for, I say, at least one night. If they want to stay longer, that's fine. And that's just to keep them comfortable. They monitor their drains. And what I do it for is in case there is a hematoma, in case there is any bleeding, there is somebody who's watching and monitoring and can get a hold of me if the need arises.
Right. And that, I think the aftercare for a night or two is great. It just makes a big difference.
It makes a huge, everyone I know who does it, which is all my patients, are like, I'm really glad I did that. I needed that. Because this is not really the time for your spouse, no matter how great they are, even if they're a nurse, especially if they're a doctor. It's not the time for them to be taking care of you. Like, just let the professionals take care of you, keep you comfortable, bring you your green smoothies, let them do what they do. And then I also prefer that my patients go to hyperbarics. This also may be a regional thing. We have a million hyperbaric places in the Beverly Hills area. Hyperbarics, you have a whole podcast on it. Basically, it's super concentrated oxygen that you breathe in for an hour or 2 hours. I say if you can do it for at least 3 days, 3 to 7 days after surgery, it makes your healing so much better. The blood flow is preserved. You have less issues with swelling, less issues with wound healing. So I like patients to go the next day if they can. Yeah,
hyperbaric oxygen is really key. I mean, the short version of it is that hyperbaric oxygen is used for wound healing. It's it's medically prescribed. Insurance pays for it. This is an elective situation, so you're going to pay cash for the session. But it's still, this is a wound healing thing, so you want your wounds to heal really well, and the hyperbaric oxygen helps a lot. Let's address the hemostatic net versus drains, because people always say, "Oh, am I going to have drains?"
Right.
And or they now are seeing like these hemostatic nets where people are, which I'm doing a lot, sewing the skin down to the underlying soft tissue with a very fine suture.
But it looks like a net because the suture is going over and over through the skin, so it kind of has that like fish net appearance to it.
I mean, I'm not going to lie. The first time I saw it, it was Michael Grotting that came to USC as a visiting professor. And he's like, "Now, y'all got to get ready for this." And he showed it, and it looked like, he turned his patient into Hellraiser.
Yeah, you're like, "Woo!"
But it does work. And
It works, and the sutures come out in a day or two.
It really does, and it makes a big difference for two reasons. One, yes, it is hemostatic, but I still put a drain anyway. And then the other thing is...
Hemostatic means it controls bleeding.
Thank you for the
I translate.
for the glossary of terms that there will be a test at the end of the year. But then I'll still put a drain, which is a 10 French drain. People are like, "Oh, do I have to have drains?" It's in for a day. It comes out a day or two after.
You
at the
barely
longest.
register it in because you're like in your post-anesthesia fog. The
don't worry
nurses
about
are
it.
draining it. Like, don't even worry about that drain. It'll be out before you even register that it's there.
Yeah, and then we're going to see you a lot after surgery. We're going to start taking sutures out at certain times. The eyelid sutures I like to get out of 5 days, 4 days, 6 days, something like that. The sutures in front of the ear, under the chin, in 7 days, behind the ear, maybe 10 days. There's a lot of interaction with the surgical team. If I'm not doing it, it's either my fellow or my PA or one of the nurses that are taking stitches out. But I typically do it myself. I want to see my patients.
Yeah, no, I agree. There's a lot of follow-up, especially in that first week or two, and you're there pretty frequently making sure all of these things are being managed appropriately. I, right after surgery, put patients in sort of like a head trauma wrap. Like I know you do. You kind of look like you're like this bobblehead all wrapped up.
The Calvert helmet.
Yeah, pretty much. Like nothing's going anywhere under those bandages. You're like a war veteran. And then the next day, all of that comes down, and I switch them to just a chin strap that they wear. Under their chin. And I like them to keep that as long as possible, a couple days at least. And then I say for at least at night for a week or so, but as long as they can tolerate it.
Bruce Cannell was a guy I learned to do the smash flap facelift, operation from, and he didn't like to put any dressings on. And when you ask what happens in other parts of the country, well, he'd just keep them overnight in the surgery center. We're not allowed to do that in Beverly Hills because there was a feud back in, I think, the 70s between two plastic surgeons. One had the ability to keep them overnight. The other one didn't. And the one who didn't had a friend on the city council and got an ordinance passed. So that's why we can't do it in Beverly Hills.
That sounds about right.
Yeah, exactly. Yeah. So, but around the rest of the world, you can keep your patient overnight in your surgery center and then, send them home the next day or keep them there 2 nights. But the aftercare facilities have been, I think, a really important part of the success of the operations because it is really nice for them to be taken care of with all the right foods and you're not eating a whole lot anyway, but they give you some smoothies and then they have the hyperbaric chamber right there and then all that stuff adds up to success, which is why people come to Beverly Hills to have facelifts. It is you're stacking the cards in your favor. We do it a lot. We do and it's just it's a cultural thing here where I think I like our results. That's my opinion.
But as you can see, there's a lot invested in it from the beginning to the end and the aftercare facilities and the care that we take care of the patients. And everyone always asks, well, when can I go back to work or when can I be seen in public? The short answer is depends on what you do. You'll be swollen and you'll be maybe a little bruised for the first week or two. The swelling does start to come down pretty quickly. For people that know you, they'll know that you're swollen, that you look a little different. But the average person on the street that's never seen you before probably won't look twice at you after 10, 14 days. So if you have a job where you do have to be back in person, plan on going back maybe 2 weeks. 1 week might be a little early, but 2 weeks should be okay. You'll need a little makeup to cover the scars, or you just go around telling people you had a facelift, like whatever you feel comfortable with. But really, the swelling starts to come down significantly at 6 weeks, even more at 3 months, and then final results really up to a year in terms of how things settle. But you can be out in public, you can be doing your activities and your shopping and your restaurants 2 to 3 weeks.
Yeah, and I tell people I don't take the pictures till 5 months because that's kind of when I don't want all the on the way to healing. Right. In 5 months, it's still not done.
Right.
But that's when you can get a good assessment of what the effect of these operations has produced for the individual
Right.
patient.
And to be fair, at 3 weeks, at 6 weeks, you will look great.
You'll look great.
You will look phenomenal.
Totally.
You will look even better.
But you'll be
at 5
complaining about
months. It's still a little loose there, so it's going to go down, but
Yeah.
you're going to look amazing. You're going to see your results right away.
Totally.
But you're really going to see the final results anywhere from 6 to 12 months.
Yeah, and that's the part that I just tell patients that you have to understand. You got to heal these things up. One of my patients came in and said, and I hate to bring it up, and I'm not going to get up on the box. I won't. I promise you.
Promise.
But she said, I don't understand. I'm 2 months out from surgery and I'm still swollen and I still have these things going on. I looked on so-and-so's Instagram and at 3 weeks, his patients look perfect. I go, now you went through the operation. Does that make any sense that they look perfect at 3 weeks? And she goes, oh, no, it doesn't make sense. I was like, okay, so think it through.
Yeah.
So buyer beware. There's a lot of monkey business with photo tricks, timings. I mean, there's a rhinoplasty surgeon that pops the splint off, at the 1 week thing, then brings them back at the 1 month mark and then puts the splint back on and takes it off like it's the 1 week follow up. There's a lot of monkey business that you have to be aware is out there. And so you can't just take it on blind faith that the marketing is real. So, and certain specialties have certain rules. Like as plastic surgeons, we could never do that. But there are other specialties where their marketing stuff is they could do whatever they want and nobody's going to say anything about it. There's nobody watching over them. They're not going to lose their boards as we would if we did those sort of things. So just kind of as you're assessing who's doing your facelift, do the math. If it doesn't make sense to you, then it probably doesn't make sense.
Yeah, I definitely agree with that. And that all just underscores the idea that this is a very real surgery. This is a very real
Hell
surgery.
yeah.
It takes a while. We're rearranging all the components of your face. So this is not a lunchtime lift. This is not like a little, oh, by the way, I'm going to just do this. These are very real surgeries, and they have a very real recovery time. And I think the only other thing I'll mention about recovery long term is that this does not mean that you no longer have to do your Botox, your fillers, and your lasers.
Correct.
This just means that when you do your Botox, your lasers, and your fillers, the results will be outstanding, and you may have to do less of them than you did before. But if you want to maintain your results, you still have to do all of those maintenance things, and that includes things like skin tightening, like Morpheus, or any kind of laser work on the quality of your skin. You still have to do the Botox. So you have not done away with maintenance of your face. You've just sort of reset the clock a bit.
Yeah, and that's why, truth be told, that's why I made my Medi-Spa, the Rock Spa, which, the whole concept is after before you do this or after it, you're getting all those, it's your aesthetic attitude that you want. It's, are you taking care of your face like you take care of your teeth, like you take care of your heart, like you take care of your exercise physiology, all the things that we do to take care of ourselves. Well, aesthetics, we all want to look great. That's when we get up in the morning, we, take a shower, brush our hair, put on makeup. I don't put on makeup, but maybe I should start. But that's the thing is we do all these things that are designed to make us look our best. So aesthetics are really a key component to feeling great and looking great and, putting your best face forward. So you will continue to do Botox and fillers or whatever you do with your aesthetic practitioners. We have our PAs, and some nurse injectors that are amazing. You have to understand that doesn't end. It's actually I think even more important if you want to max out your result.
I agree.
Well, I think that's about it for our Facelift 101. I think that's a good little starter kit. We do have lots of other episodes about the techniques, deep plane facelifts, smash lifts, everything. We have stuff about the incisions. We have a whole podcast about preservation facelift, preserving the tuft of hair in front of the ear. That's always a good one because once you see it,
many soapboxes for everyone to listen to.
If you want some rants, go to the other episode. I didn't rant during this episode.
You did not.
No, I tried not to.
Almost did not.
I got a little one in, just a little one, but those are all really good because then you can do a deep dive into the techniques and all that because the more I think as a patient, the better a patient you're going to be, and you can really be a partner with us in these endeavors because it is knowledge is really key when it comes to how you heal up the facelift, do well, and then keep it looking great as you go forward through life.
That's right. I like it.
Well, in that case, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.